few words of advice for residents. So one of the best pieces of advice I received came from a mentor in medical school. He said, listen to your patients, they're giving you the diagnosis. He was this old school doc who really drilled us in the importance of the physical exam and spending time at the bedside. He always wanted us to understand there was no CAT scan or x-ray that could take the place of a physical exam, of putting your hands on the patient, listening to their lungs, watching how they're breathing. And that's something that's definitely stayed with me through my time as a doctor. Secondly, I would say you're not going to know the answer to every question, but have a plan for how you're going to figure it out. And by that, I mean, prepare your own personal resource toolkit. I like pocket-sized books. You might prefer phone apps, but there's a myriad of resources out there, and you should just have 2 or 3 at the ready for the case that comes in the middle of your shift where you're just like, oof, I haven't seen this in quite a while. Like, what's the dose of that medication? Just to have a plan for how you're going to answer those questions in the heat of the moment. And then finally, a bit of wellness advice. I'll say that it's really important that at the end of every shift, you take a look in the mirror and tell yourself that you did a really good job, even on the hard days, especially on the hard days. Congratulate yourself for tasks big and small, for the difficult intubation, for the difficult IV line, for the distressed patient that you managed to get a rapport with. So many of the most important things we do as doctors aren't going to be captured by any meaningful metric. So it's really important that we give ourselves credit for those things.